All right, folks, welcome back to the show. It's a special edition of Fast Forward Life After COVID-19. Do you remember crowded commutes and concerts and bars and game days? Well, in 2021, with the vaccine being shipped all across the United States, we could potentially see a return to normalcy for schools, offices, even restaurants. Joining us now to discuss the larger implications of the vaccine is Dr. Anthony Harris, Chief Innovation Officer and Associate Medical Director for WorkCare. Dr. Harris, great to have you. Thank you so much for taking the time, sir. How soon could we really see this vaccine being distributed widely, being made widely available? And from there, how soon do you think until things are returning to, dare I ask, normal? And and what does normal look like?
Sure. So if we look historically at distribution of vaccines in the U.S. in the past, and then we try to map that out and look at what's to come for us now that we have vaccines being approved by FDA, we know that there's still about a 60-day period in which there's going to be some reporting of adverse events, and that program will propagate until beginning of next year. And then after that, we see states will then order larger quantities of the vaccine, both Pfizer, Moderna, and at that point we have AstraZeneca or J&J approved. Those larger orders will then be pushed to several tranches of patients or the general population, but that's not going to happen until April at the earliest. It'll probably be May or June before most will have access to the vaccine throughout the U.S. And then thereafter, if we drill down into the numbers, looking towards that beautiful word we all have become familiar with, herd immunity. It's not going to be until the end of next year, end of 2021, that we're going to reach that number, which is around 196 million Americans immune to COVID-19.
Wow, that's a fascinating timeline. So for people who are, and rightfully so, I think very excited about the vaccine progress we've made, Dr. Harris, in the last few weeks, that's a fair gauge. I mean, you're really saying you're talking Q3, Q4 of 2021 until a bit of a return to somewhat normal because of the numbers. Is that correct?
That's absolutely correct. And if we look at the hopes that some may hold that, hey, once I've been vaccinated, me myself, I'm getting vaccinated today, right? But does that change our sense of normalcy in terms of mask wearing and social distancing? The answer is no. Even after you're vaccinated, you still got to use those precautions. One reason is because the vaccine, Pfizer in this case, is 95% effective, not 100%. So there's still 5% of people that will be susceptible to COVID-19 and can transmit it. The second is the custom, all right? In terms of the workplace or the school, you don't want to have a segment of people walking around with no masks and not using precautions because that's going to not bode well for the majority of individuals who have yet to be vaccinated. So again, it's going to be some time before we reach that sense of normalcy, even with the vaccine being distributed, if everything goes well as planned.
Did I catch the little stealth line there? You're getting your vaccination today, Dr. Harris?
You heard me sneak it in. That's right. And that's some of the messaging that we've been doing at WorkCare with all the employers that we work with nationwide, because we want to reassure the population that this vaccine is safe. So I believe I'm the first physician in our physician group that we're nationwide to receive the vaccine, and we're sure going to publicize it. So we're ready.
Congratulations to you. Congratulations and your colleagues on there. I did not want to move forward at all without bringing attention to that line that you said. I'm very excited for you and for everyone that you work with there. I know this has been a very long time coming, and work I'm sure that you've been doing that the rest of us even have no idea. So congratulations to you for whatever that is worth. Let's talk about some of these precautions that all of us here have grown to learn and love, maybe love. We're talking about things like social distancing, wearing masks, having hand sanitizer as readily available as our cell phones. I mean, this is the new normal for us. To what degree, Dr. Harris, do you see Americans writ large still continuing with these practices? Or, are you concerned that even if the public health guidance is to continue some of those protocols, people are going to have a bit of COVID fatigue into 2021?
Well, you nailed the buzzword there, right? COVID fatigue. And what that means is that some people have decided flat out, hey, I'd rather take my chances getting COVID versus practicing these measures that we have had in place for some time. And the hope is then that we can engender a sense of, hey, we're still in this, but we're still all together trying to get to the other side of this. And so keep those precautions in place, right? The new norm, again, will exist in almost perpetuity. And the reason why I say that is even with the vaccine in place, even once we reach that critical number around 196 million Americans, we're still going to be looking at a cyclical, seasonal COVID cycle year to year. So if you listen to Tony Fauci, which we agree with, that could be 5 years that we're dealing with COVID. So the new norm will still mean something in the future. And I think, albeit not the same as the drastic measures that we've had to see, we'll still have that hand sanitizer and frequent hand washing as a part of our new cultural norm in the US. And that'll help us all out in terms of preventing other types of infections as well.
And so that then leads me here to what's my final question here, Dr. Harris. What are those big learned lessons you think for 2021 and beyond? You mentioned Dr. Fauci. He has said before he doesn't think people should be shaking hands anymore, pandemic or not pandemic. He wants to see some changed behavior to what we've adopted over the course of our lives. Where do you think we head from here?
I think he's right. I agree, right? We can do it in terms of our mindset and how we approach and greet each other to minimize spread of disease, not just at the pandemic scale, but even with the flu, seasonal flu, or the common cold, right? One of some research that has been done several years ago looking at prisons showed a cultural shift in how prisoners and guards were greeting each other, and that was with a fist bump, right? And that simple act alone reduced transmissions of communicable disease from those populations. And that's something that we should consider strongly as a general population and approach to how we greet each other. Because at the end of the day, this won't be the last pandemic. If we go back to 400 BC, the first recording of a pandemic, and fast forward through time and look at the averages in which pandemics occur, we're facing a pandemic now, if you look at the last 5 to 8 years, every 12 to 20 years. So again, this won't be the last that this generation will see in their lifetime.
The soon-to-be vaccinated Dr. Anthony Harris, my thanks to you, sir, for taking the time on a big day for you, Chief Innovation Officer and Associate Medical Director for WorkCare. Thank you, Dr. Harris, and good luck, sir.